I recently had the honor of speaking with Dr. Manesh Patel, Chief of Cardiology at Duke and Physician VP for Heart and Vascular Services at the University Health System. Dr. Patel shares invaluable insights on the vital role of philanthropy to advance cardiology research and the exciting opportunities for involvement through our recent development campaign, Made for This. Manesh, thanks for speaking with me today.
Thanks for having me.
So as you know, Duke University and Duke Health is just launching a very ambitious capital campaign. Can you talk a little bit about how philanthropy has furthered cardiology's research?
Yeah, thanks, Dean Klotman. I mean, I think the big picture for us is that unfortunately cardiovascular disease is still the leading cause of death and disability.
Right.
The HA says by 2050, if we don't do anything, 61 million Americans will have cardiovascular disease risk factors or outcomes. And what philanthropy does for us is really help us think about those moonshot-like projects and support the people to get there. And so, you know, we have fellows, faculty, and then projects where we think we can make a really big difference. And to date, philanthropy's helped, I'll call it, everywhere along that pathway, sometimes supporting our fellows as they're thinking about these projects. Faculty that have innovative programs that otherwise wouldn't be funded in other ways that are really trying to solve a problem, cure something that we haven't done in heart disease. And then potentially support programs where we get closer to our patients and make their health better.
Is there one that comes to mind?
Yeah, you know, I'll say the one or two big ones are, you know, one of our junior faculty had this idea that we better understand the metabolism of the heart. How does the heart work better? And presented this idea, and it had a great catchphrase, you know, the heart is an omnivore. It'll use whatever energy it can use. Yeah. But wanted to do a project where we were going to measure blood in the heart and then measure blood in different parts and then understand if that metabolism leads to better performing hearts. That's a kind of a project that doesn't get funded in other ways. You have to have big teams, and our Heart Center Leadership Council funded that in different ways. That's actually led to really important insights and now a whole new area of research. And then other work that's bigger, people working with saying, how do we do genomics across a bigger system? And then philanthropy to help people that have had a mechanical heart just to make sure they get care where they need it.
So when you're looking forward, what are some of the challenges and opportunities you see for cardiology research?
Well, you know, it's the people and the projects, just like we discussed, you know, and I think at this time where there's even fewer resources to think about how do you build that platform. So what are the challenges I think that are in cardiology research are probably true in all of medicine, which is that there's huge amounts of data and patients we take care of. Probably the largest growing amount of information in the world is health data, and yet 3% of it's used to take care of people or to better learn from them. At the same time, the biologic information, the genomic information is going to transform cardiovascular disease. I don't believe hypertension is one disease. I think it's multiple diseases, just as we're learning diabetes has multiple components to it, just as we learn heart failure does. So the opportunity for cardiovascular research is to bring these two big data sources together, and we're actually, as the campaign says, made for this. I mean, we have the largest research clinical trial institute in the country in the DCRI with regulatory expertise now, previously and back again with Dr. Caleb.
Right.
We have a very large clinical footprint that actually tries to personalize care. We have a CVRC that has a Nobel laureate and others in there that might account for over 50% of the small molecules. And then we have Swati Shah, who's leading a health system-wide One Duke genetic initiative to not just in cardiovascular, get the genomes of people to better understand. So you can imagine from a discovery standpoint to a delivery standpoint, it's really meaningful. But I think the future is going to be that we better understand different phenotypic or personalized care pathways to understand why people respond to different things, and that'll inform the discovery of the next generation.
So the challenge and opportunity is really using that data.
Yeah.
And how does that inform the types of fellows and faculty you want to recruit?
Yeah, so I'll tell you that, you know, we really want to get to where we say we have personalized cardiovascular health, performance, and discovery. And if you think about the fellows and faculty that we're not only trying to recruit, we have 1,000 fellows applying for our 10 spots. Wow. And our opportunity is to continue to support them and scale them. And when we think about that, building the leaders of tomorrow and the faculty, they're going to need skills that we previously may not have had, whether it's computational skills, understanding biologic interplay, care delivery models, a lot of that, and then teamwork. How do you function in teams to be really effective?
So those fellows, it's really about supporting their early career development, and that's very challenging.
It is, and I'll just say I benefited from sometimes a longer fellowship than people would have thought, but that opportunity allowed me to learn things, and so did our fellows. You know, so those research years, not just the clinical years, where they can go, whether it's at the DCRI or the DMPI or different places where they might take care of patients and enroll them, actually lets you think broadly. And we've had investment from philanthropy on what I'll call an AI Innovation Collaboratory, where our fellows can go and say, hey, this is a better way to think about it. A few of us have been working on a virtual reality studio for the cath lab. That's the kind of training programs for our fellows that we're going to need, and those are the kinds of, I think, fellows and resources that are going to be the things we want.
And your passion and excitement really attract those fellows here, and I'm sure that happened when you visited Duke.
Yeah, one of the things that I think is the best part about being at Duke is the people, as you know, and it's the opportunity to make a difference. Life is about service and purpose and the impact you can have, and some of the support we've had is to allow some of those fellows to have dreams that we wouldn't have thought about to make them happen. And some of them are not great ideas. I've had ideas where people said, oh, and I've thought that. And then sometimes they work out. We had a fellow who came to me and said, we have heart failure wrong. We think the fluid in the abdomen's the problem, not in the chest. I said, well, how would we manage that? He said, well, I think if you match me here at Duke, I will measure the pressure in someone's heart and then inject a lidocaine bolus into their back to dilate the vessels and see if that changes the pressure. Now, an outside-the-box idea, but it's changed how we think.
Was the fellow right?
The fellow was, so I said, if you match here, I was the cath lab director, I said, so that he did the work to enroll patients, and the first patient we did it in, we got anesthesia to inject the back of the patient, and the pressures dropped, and I thought, well, it's just one patient. But after 7 or 8, we realized this might be a new pathway to treat patients. So it's that kind of energy when somebody pushes you to make you think differently about biology that really makes us move.
One of the other aspects of Duke that I think really enables success is collaborating across the institution. How does cardiology do that?
Well, I would say cardiovascular care with our CT surgeons, our vascular surgeons, anesthesiologists, just one in care, but second in the science of that care. And so that's across the university. There are people in our group working with Amanda Randalls and the engineering group building digital twins for heart failure, and how do you manage that? Charlie Gershbach and Svati and others doing genomic research. How do we think about that?
So you've been here for a while. What makes you most proud of being a member of Duke Health?
It's an exciting part of what we do, and I guess the things that make me most proud are the things that I see. It's a pay-it-forward organization. People gave me opportunities to do the things I get to do. I get the most pride when a fellow or a faculty member does things, or my colleagues do things. And as I look back, I see some of the tremendous additions to the field of cardiovascular medicine that we've done.
That makes me very proud. Thank you, Manesh, and thank you to all your team.
Yeah, thanks for having me.